Hello, everyone. I'm very excited to be here. Thank you for the opportunity. I will start by introducing myself. I am a clinical research professional, as you all know. I have over 10 years of experience working with patients at various research sites, including community hospitals. So, my role is to provide oversight for cancer trials. I have seen firsthand how participating in a clinical trial can improve life expectancy and survival rate. At the same time, I reflect on how little awareness there is in my own community regarding clinical trials. I've also seen only a handful of people from the Sikh community working as research nurses, doctors, or monitors. We need representation. This is what inspired me to start SICR in clinical research, so everyone is well informed of the available opportunities and everyone has equal access and representation in healthcare and clinical research. I'm very passionate about clinical research and health equity, as you can tell. My passion and expertise have called me to contribute to increasing representation, which I believe is truly a noble calling. We all know health disparities are rising. There could be a variety of reasons. People miss their doctor's appointments. There could be language barriers, cultural barriers. People may not have health insurance, or they may not have transportation to make it to the doctor's appointments. People are not getting regular health screenings done simply because of the reason that there is lack of education and they are being diagnosed at a later stage when conditions are non-treatable. It's a huge disconnection. And how can we make a difference? Everyone, regardless of who they are, what their background is, or their race, ethnicity, or gender, everyone has a right to be as healthy as possible. SICR in clinical research is a growing initiative to raise awareness of clinical research as a career, care, and treatment option within the Sikh community. I often ask my community members, how many of you have participated in a clinical trial or know someone who has? Most have not. And the truth is, most people are never even informed of or educated on clinical trials. Health is one of the most important rights that we are born with, and we need to take hold of that right. Every person deserves equal access and opportunities when it comes to healthcare and clinical research. And representation is not optional. It is fundamental for scientific rigor, safety, validity, and better health outcomes. If we take an example, carbamazepine, an epilepsy drug, caused severe rashes in some Asian communities. If these populations had been better represented in early research, this could have been prevented. If communities are not part of research, treatments may not be safe and effective for them. Representation in workforce is equally important to address language and cultural barriers. There are more than 500,000 Sikhs living in the United States. However, because of limited awareness, participation in clinical research remains low. We encourage our youth to explore clinical research as a career opportunity, and we share with them the free basic training resources to help them learn clinical research from the beginning. One of our goals is empower women. As a woman myself, I would love to see other women from my community in leadership roles in healthcare and clinical research. We run a monthly guest speaker series inviting industry experts to share insights on topics such as their career journeys, patient safety, or drug development. These sessions help empower community members to explore different career paths. So far, I'm happy to announce that we have hosted more than 35 guest speakers. We also encourage doctors to become principal investigators on clinical trials so they can offer patients access to cutting edge new treatments and also stay up to date with medical advancements. This is a very useful resource that we have created for doctors to help them understand how to integrate clinical trials into their practice. This is one of my favorite slides. The Sikh community has always been ahead in humanitarian service, to blood donation drives, when it comes to charity, contributing globally, and helping others as the Sikh values we carry. Even during the pandemic, Sikhs have been ahead when serving free meals and Sikh medical professionals treating affected people. When disasters strike, Sikhs show up with hands ready to serve. One of its most beautiful traditions is the free meal to anyone who is in need. I wonder, why are we behind in research? So, our goal is to engage directly with community members, meet with them where they are, help them understand clinical research, and build trust. Community engagement is at the core of everything we do. We meet people where they are. We set up educational booths and educate the community in their own language. We promote disease awareness and the importance of regular health screenings. We improve health and research literacy and help people navigate clinicaltrials.gov to find trials in their area. We help them understand that there are safeguards in place, for example, the consent form process and the IRB oversight. So I'm going to play a short clip from one of our past outreach events.
New York, a city full of life and community spirit. Our team was honored to be welcomed with open hearts at the Gurudwara for our awareness event. Our team brought along a nurse who answered community questions, addressed health concerns, and offered basic health screenings, including blood pressure checks. Through the feedback forms filled out by community members, we follow up with everyone to help them find clinical trials happening near their area. We also provide resources such as our Understanding Clinical Research booklet, disease awareness flyers, and educational videos available on YouTube. Even the kids joined in, reading our clinical research books and enjoying the goodies we shared after they answered questions from the books.
Clinical research ਦੀ ਬਾਰੇ ਦੱਸਿਆ ਸਾਡੀ ਕਮਿਊਨਿਟੀ ਨੂੰ ਕਿਸੇ ਨੂੰ ਵੀ ਨਹੀਂ ਇਸ ਚੀਜ਼ ਦਾ ਪਤਾ ਸੀ ਤੇ ਸਾਨੂੰ ਇਹਨਾਂ ਨਾਲ ਜ਼ਰੂਰ ਕੰਟੈਕਟ ਕਰਨਾ ਚਾਹੀਦਾ ਪਤਾ ਕਰਨਾ ਚਾਹੀਦਾ ਤੇ ਇਸ ਚੀਜ਼ ਦਾ ਫਾਇਦਾ ਲੈਣਾ ਚਾਹੀਦਾ ਆਪਣੀ ਕਮਿਊਨਿਟੀ ਵਾਸਤੇ ਤੇ ਇਹਨਾਂ ਦਾ ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ ਇਹ ਆਏ ਇੰਨੀ ਜਾਣਕਾਰੀ ਸਾਨੂੰ ਦਿੱਤੀ ਜਿਹੜੀ ਸਾਡੇ ਕਿਸੇ ਮੈਜੋਰਟੀ 99% ਕਿਸੇ ਨੂੰ ਨਹੀਂ ਸੀ ਪਤਾ ਇਸ ਚੀਜ਼ ਦਾ ਕਿ ਇਹ ਵੀ ਐਗਜ਼ਿਸਟ ਕਰਦੀ ਹੈ ਜਿਹੜੀ ਕੰਮ ਹੈਗੀ ਹੈ ਔਰ ਇਹਨਾਂ ਨੇ ਇਹ ਵੀ ਦੱਸਿਆ ਕਿ ਇਸ ਦਾ ਇਲਾਜ ਜਿੱਥੇ ਵੀ ਤੁਸੀਂ ਡਾਕਟਰ ਰਿਕਮੈਂਡ ਕਰਨਗੇ ਕੋਈ ਫੀਸ ਨਹੀਂ ਹੈਗੀ ਹਰ ਚੀਜ਼ ਫ੍ਰੀ ਹੈਗੀ ਹੈ ਤੁਸੀਂ ਉੱਥੇ ਜਾ ਕੇ ਆਪਣਾ ਦੇ ਸਕਦੇ ਹੋ ਜੇ ਤੁਹਾਡਾ ਮਨ ਮੰਨਦਾ ਹੈ ਤੁਸੀਂ ਕਰ ਸਕਦੇ ਹੋ ਜੇ ਨਹੀਂ ਮਨ ਮੰਨਦਾ ਤੁਸੀਂ ਨਾ ਕਰ ਸਕਦੇ ਹੋ ਤੇ ਇਸ ਦੇ ਨਾਲ ਨਾਲ ਆਪਣੀ ਸਿੱਖੀ ਦਾ ਪ੍ਰਚਾਰ ਕਰ ਰਹੇ ਹੋ ਤੇ ਈਵਨ ਡਾਕਟਰਾਂ ਦੇ ਕੋਲ ਤੁਸੀਂ ਜੇ ਜਿਸ ਤਰ੍ਹਾਂ ਹੁਣ ਗੋਰੇ ਡਾਕਟਰ ਹੁੰਦੇ ਉਹਨਾਂ ਨੂੰ ਨਹੀਂ ਪਤਾ ਹੁੰਦਾ ਸਿੱਖਾਂ ਬਾਰੇ ਤੇ ਇਹ ਇਹੋ ਜਿਹੀ ਚੀਜ਼ ਤਿਆਰ ਕਰ ਰਹੇ ਆ ਉਹਨਾਂ ਨੇ ਤਿਆਰ ਕੀਤੀ ਹੈ ਜੇ ਤੁਸੀਂ ਉਹਨੂੰ ਡਾਕਟਰ ਦੋਗੇ ਉਹ ਉਹਨੂੰ ਵੀਡੀਓ ਵਿੱਚ ਦੇ ਸਕਦੇ ਆ ਕਿ ਸਿੱਖੀ ਕਲਚਰ ਕੀ ਹੈਗਾ ਉਹਨਾਂ ਦੇ ਕੀ ਉਦੇਸ਼ ਹੈਗੇ ਕੀ ਕਰੇ ਕਿ ਕਈਆਂ ਨੂੰ ਲੋਕਾਂ ਨੂੰ ਪਤਾ ਨਹੀਂ ਹੈਗਾ ਕਿ ਬੜੀ ਟਰਬਨ ਵਾਲੇ ਦਾੜੀ ਵਾਲੇ ਕੌਣ ਲੋਕ ਹੈਗੇ ਇਹ ਉਹਨਾਂ ਦੀ ਜਾਣਕਾਰੀ ਵਾਸਤੇ ਇਹਨਾਂ ਨੇ ਵੀਡੀਓ ਬਣਾਈ ਹੈ ਜਿਹੜੀ ਤੁਸੀਂ ਛੋਟੀ ਵੀਡੀਓ ਹੈ ਜਿਹੜੀ ਤੁਸੀਂ ਉਸ ਡਾਕਟਰਾਂ ਨੂੰ ਦਿਖਾ ਸਕਦੇ ਹੋ ਤੇ ਉਹਦਾ ਫਾਇਦਾ ਲੈ ਸਕਦੇ ਹੋ ਥੈਂਕ ਯੂ
ਸਿੱਖ ਐਂਡ ਕਲੀਨਿਕ ਰਿਸਰਚ ਜੋ ਕਿ ਏਕਤਾ ਭੈਣ ਜੀ ਦੀ ਟੀਮ ਪੂਰੀ ਇੱਥੇ ਗੁਰਦੁਆਰਾ ਸਾਹਿਬ ਸਿੱਖ ਸੈਂਟਰ ਆਫ ਕੁਈਨਜ਼ਵਿਲੇ 222 ਗੁਰਦੁਆਰਾ ਸਾਹਿਬ ਪਹੁੰਚੀ ਆ ਜੋ ਕਿ ਅੱਜ ਉਹਨਾਂ ਨੇ ਇੱਥੇ ਆ ਕੇ ਸਟੇਜ 'ਤੇ ਸੰਗਤਾਂ ਦੇ ਨਾਲ ਰੂਹ ਕਰਕੇ ਜੋ ਕਿ ਆਪਣੇ ਭਾਸ਼ਣ ਦੇ ਵਿੱਚ ਜੋ ਵੀ ਦੱਸਿਆ ਉਹਦਾ ਸਾਨੂੰ ਬਹੁਤ ਲਾਭ ਹੋਇਆ ਕਿਉਂਕਿ ਇਹੋ ਜਿਹੀ ਟੀਮ ਪਹਿਲੀ ਵਾਰੀ ਗੁਰਦੁਆਰਾ ਸਾਹਿਬ ਆਈ ਆ ਤੇ ਇਹ ਸਮੁੱਚੀ ਟੀਮ ਦਾ ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ ਨਾਲ ਉਹਨਾਂ ਨੇ ਜੋ ਕਿ 5 ਕਕਾਰਾਂ ਦੀ ਵੀ ਗੱਲ ਕੀਤੀ ਆ ਗੁਰੂ ਸਾਹਿਬ ਦੀ ਵੀ ਗੱਲ ਕੀਤੀ ਆ ਸਿੱਖਾਂ ਦੀ ਵੀ ਗੱਲ ਕੀਤੀ ਆ ਇਹ ਬਹੁਤ ਵਧੀਆ ਵੱਡਾ ਉਪਰਾਲਾ ਮੇਰੀ ਵਾਹਿਗੁਰੂ ਅੱਗੇ ਇਹੋ ਅਰਦਾਸ ਹੈ ਸਮੁੱਚੀ ਟੀਮ ਨੂੰ ਵਾਹਿਗੁਰੂ ਚੜ੍ਹਦੀ ਕਲਾ ਬਖਸ਼ੇ ਤੇ ਵੱਖੋ ਵੱਖਰੇ ਗੁਰਦੁਆਰਾ ਸਾਹਿਬ ਜਾ ਕੇ ਉਹ ਆਪਣੇ ਜੋ ਵੀ ਇਸ ਟੀਮ ਆ ਉਹ ਆਪਣਾ ਯੋਗਦਾਨ ਪਾ ਕੇ ਹੋਰ ਲੋਕਾਂ ਨੂੰ ਅਵੇਅਰਨੈਸ ਕਰਨ। ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ।
Our founder, Ekta shared her message, "My guru is my physician." Medicines take effect when taken with prayers. She also encouraged everyone to get health screenings and explained how, by visiting clinicaltrials.gov, entering your zip code and medical condition, you can find ongoing trials. These trials are voluntary, regulated, and an important way to know your options. We were delighted to meet professionals in the city, and even happier to learn that some people already knew about us through LinkedIn and other social media channels. We also left behind a poster on the wall, educational brochures, and books for kids. A heartfelt thank you to the Gurudwara committee members for their warm welcome and support. They expressed how happy they were to host us, and even told us that we are welcome anytime. For more information, visit seeksinclinicalresearch.org.
When we benchmark ourselves and how we have been performing, I'm very proud that we have come so far. We have organized 50 plus educational events in 15 plus states. We have engaged with thousands of community members, distributed tons of educational materials, and our email subscription list is grown to more than 2,000 people. I wanted to share our recent survey results, which shows disease prevalence in the community. Cardiovascular conditions are the number one major health concern. Out of 400 people who completed the survey, 241, which is more than 50%, reported having a cardiovascular related condition. 140 of the 400 individuals had diabetes and cholesterol. Then we also have cases of arthritis, dementia, asthma, cancer, and many more. This data helps us understand the disease types most affecting the community and where more education, awareness, and support are needed. Behind each face was a story, a health struggle, and a hope for better care. There are people out there desperately looking for treatment options, and it becomes very important to raise awareness of clinical trials so people know their options. During our community events, we also do pre-post event surveys. The data shows that participants' awareness of clinical research doubled. This is how we measure our success. There are inherent biases and assumptions often made about certain patient populations, and we need to be mindful of them. Many individuals would be interested in participating in clinical research if they were given the opportunity. However, when we assume they won't participate and never ask, we exclude them before they even have a chance to consider. As research sponsors, healthcare providers, and those committed to inclusion, we have to erase all of that and come with a clean slate. We started a patient-focused perspective series where we invite patients to share their stories. One of them said, "You have to be your own advocate. It's your body." And I could not agree more, and these words have stayed very close to my heart. So you can check these out on our YouTube channel.
So I used to go for regular mammogram. For 2012, I was going for a mammogram. They said, okay, everything's fine. I used to have a mammogram and an ultrasound. So us to baad unhone kya okay, you're fine to go. So a week later, they called me. And I was taking a plane to India. I said, okay, I'll come back and I'll talk to you. My doctor said, no, you have to come back for a repeat ultrasound. So in India, I went for a repeat ultrasound and I found out that I had stage 2 cancer. So my kids were younger. So at that time, they both were in middle school. So it was like, and I'm a physical therapist by profession. So I was like, you know what? I see people who are 100 years old, and they're still living. So nothing can go wrong with me. फिर मैं वापस आके टेस्ट वगैरह कराया. I went to Alexander Brothers, if you would allow me to say that. And the doctor that I saw there said, "Oh, we're going to do a biopsy." So they did the biopsy, and then, you know, I reached home and he said, "Oh, come back, and we're going to do a lumpectomy for you." So I specialize in lymphedema in women, and I said, you know what, I will not do a lumpectomy right now. I want to see what's happening on the other side. They did not even check the other side. So I just grabbed all my films and my x-rays, everything that I had, MRI, CT scans, ultrasound reports, and I went to Northwestern. So there I did my own research to see who was the leading doctor who had experience but also was leading in research articles. So I went to him, and he told me that there's not one spot, but there are 4 spots, 4 different spots, and he recommended a mastectomy. So I went ahead and I did my mastectomy. I had about 12 chemo. So I used to have it on Thursday, and then Tuesday my flu symptoms were gone, my chemotherapy symptoms were gone, and then I would go back to work. And then I would come back, you know, again 2 weeks later, go for the same thing continued. I had 12 rounds of chemo. Then I did go for a second opinion for radiation, just so to rush. I just wanted to make sure, do I need it? And they said I don't need it. So since then, 12 years down, breast cancer free, and then I do have my mammograms regularly. I have a daughter who is 27. I'm, you know, making sure that she goes through it, because when I had my mastectomy, there was a 26-year-old girl. The same day she had a bilateral mastectomy. So people have this thing, you have to wait till 30. I would say, I think in your 20s, and especially if you have a family history of breast cancer, they should go ahead.
That's what we are emphasizing today.
Early.
That's why we set it up today.
It's free. Most insurance, companies pay for it. So why not? You know, blood tests, mammograms, and then you have to be your own advocate. You know, you have to know it's your body. You know, for a doctor, I'm just a number.
Yeah.
So I think women have to be advocates for themselves.
फिर October month is breast cancer awareness month.
Yep.
We took this opportunity
So that's awesome.
reach out to the community.
Stigma लगता है लोगों को, you know, कि पहला तो दसदे ही नहीं है. There is a very prominent woman in our community, and while I was having it, she was also going through it. She didn't tell her husband that.
Even after diagnosis?
After diagnosis, she didn't tell her husband that, and she didn't go through the treatments. And now she's in a bad state because the cancer has spread. So you have to be so careful.
You have to be proactive. As soon as
Absolutely.
you are diagnosed, you have to take the next step.
Absolutely. Absolutely. No, it's a great initiative. So, बहुत चंगा कर रहे हो.
As far as the clinical trials, how much have you heard about that?
So I do get periodic things. You know, I'm in contact still with Northwestern. So all of genetic testing, and you know, they'll keep.
Over the years, we have created a lot of educational resources for patients in both English and Punjabi, as well as for the younger generation to help them understand clinical research and career opportunities. If we want our kids to explore careers in the healthcare and research, it must start from an early level. At a young age, we can inspire them and cultivate their minds. Please feel free to download our free resources, including guides, comics, activity books, and many more. These should be available on the website, and most of them are free to download.
Why is my participation important? Improved access to treatments. For some people, participating in a clinical trial can provide access to new treatment options for their condition. For example, cancer is a serious disease, and clinical trials can offer new possibilities for treatment. Historically, many clinical trials lack participation from different backgrounds due to limited access to information, language and cultural barriers, mistrust in the medical system. One size doesn't fit all. A person's response to a disease or medicine depends on many factors, including age, sex, gender, race, ethnicity, lifestyle, and environment, among others. People from different backgrounds can respond differently to medical treatments due to genetic, environmental, and lifestyle factors. Including diverse communities in clinical research ensures that side effects and risks are accurately understood. Treatments are effective for everyone. Health disparities are addressed. For example, if trials only include certain groups, like one ethnicity or age group, the treatment might not work the same for others and could even cause side effects. Representation in trials is important to make treatments safer and effective for all. Example, Black Americans and Indigenous peoples have the highest asthma rates compared to other races and ethnicities. Asian Americans have historically been found to have high rates of liver cancer in the U.S. By ensuring clinical trials represent people with different backgrounds, researchers may discover valuable information that helps assess how the investigational study drug works for different groups. This knowledge is key in promoting fairer healthcare and ensuring that people from underserved groups receive proper care. If you'd like to learn more about clinical research, contact us or visit our website, SICRinclinicalresearch.org.
One of the most significant tools that we have created is the Sikh Patient Care Guide to help healthcare professionals understand the Sikh faith better, so they can give Sikh patients culturally competent care. This guide covers basic principles of Sikhi, Sikh values, appearance, articles of faith, cultural sensitivities, and Sikh preferences. We also designed keychains with QR codes linked to a quick reference guide. If community members are carrying these, their healthcare professionals can have an easy access and can learn about the Sikh faith.
Treating Sikh patients, addressing language barriers.
Hi, Mr. Singh. The doctor is ready to see you now.
Okay, thank you.
Hello, Mr. Singh. I have your test results here. It looks like you have type 1 diabetes, so we'll need to start you on insulin.
Insulin?
Yes, insulin helps keep your blood sugar under control. You'll need to take it as prescribed every day. Let me explain how to use it. Dr. Andrew shows an insulin pen and demonstrates how to pinch the skin and inject.
I don't completely understand all the instructions, as my primary language is Punjabi, not English.
That's okay, Mr. Singh. Would you be more comfortable if we explain this in Punjabi?
Yes, that will help.
Dr. Andrew asked for the Punjabi interpreter.
Good afternoon, Dr. Andrew.
Good afternoon, Ms. Jaspreet. This is Mr. Singh. He has just been diagnosed with type 1 diabetes and is having difficulty in understanding. Could you please explain the process and instructions for using insulin to him in Punjabi?
Ms. Jaspreet explained everything in Punjabi and in an easy way. She cleared all the confusions and questions of Mr. Singh regarding his treatment.
Oh, now I understand. Thank you so much, doctor.
You're very welcome. We're here to make sure you understand and feel comfortable before you leave.
Here are some pamphlets in Punjabi about using insulin and checking your blood sugar.
Oh, this is good. I can read this at home. Thank you.
We'll also arrange all the follow-up appointments with the interpreter and provide Punjabi materials to ensure you're comfortable with everything.
Thank you so much, doctor. I feel more at ease now. Really appreciate your help.
You're very welcome. We're here to support you. Bridging language barriers is essential for providing compassionate care. Learn more at SICRinclinicalresearch.org.
Sikh identity is deeply rooted in faith, tradition, and a commitment to service. Understanding these values helps create a respectful and inclusive environment, especially in healthcare settings. Practicing Sikhs wear 5 articles of faith. Additionally, Sikhs wear a turban to cover and respect their uncut hair. These sacred items should not be removed unless medically necessary and only with the patient's consent. If removal is required, they must be handled with respect and either given to family or placed in a high position. Communication is key to providing proper care. Many Sikh patients, especially elders, may speak only Punjabi. In such cases, arranging for a Punjabi interpreter ensures clear and compassionate communication. Sikhs deeply value medical care and science, but they also uphold religious principles. Cutting hair is generally avoided unless absolutely necessary, so alternative solutions should be explored before proceeding. Religion plays a vital role in comfort and healing. Some Sikh patients may keep a gutka, a scripture book, nearby. If handling it, do so with clean hands. Listening to Sikh hymns, known as Gurbani, can also provide peace and reassurance. Cultural sensitivity strengthens trust. When possible, gender preferences for healthcare providers should be accommodated to ensure comfort and dignity. Every Sikh practices Sikhi in their own way, as it ultimately depends on the individual. Guidelines should respect personal beliefs and preferences rather than being imposed. While some may have distinctive appearances, others may not. Each case should be considered individually, with proper consultation, and necessary adjustments should be made to ensure the best possible accommodation. By embracing these cultural and religious considerations, we can foster an environment of understanding, respect, and compassionate care for Sikh patients. A little awareness goes a long way in making a meaningful difference.
Sikhs in Clinical Research is excited to announce a new development to expand our reach in 2026. This van is dedicated to the community for health and research awareness. We are still customizing it from the inside, and it should be ready soon. Here are some ways people can join in. We have brand ambassador and guest speaker opportunities. For someone interested in community engagement and patient advocacy, an internship might be a better option. For clinical research industry stakeholders or pharma companies, they could sponsor our events. They can partner with us on patient educational programs, help us increase our reach, and support efforts that improve clinical trials representation. All of this is because our end goal is improved public health. Sponsors must bring communities into trial design early and collaborate with community organizations for continuous support and long-term sustainability. This is really about pharma companies being authentic in their approach. It means taking a real interest in patients and their well-being, not just the study. It's about designing protocols that fit into patients' lives and make studies more accessible. Most importantly, it's about caring enough to build trust first. You need to build trust before asking someone to take part in something they are not sure about. At the end of the day, everything comes back to trust. Here I wanted to show some examples of blogs our ambassadors have published. We have been writing blogs about major health concerns in our community, for example, cardiovascular diseases, diabetes, arthritis, breast cancer. Please feel free to check out our website and take a look at these blogs. Beyond the Sikh community, we support our Chicago neighborhood through food and clothing donations. We also have been attending industry conferences to stay up to date and improve our representation. For any questions, please feel free to connect with me on LinkedIn. You can also email me at egarewal@sikhsinclinicalresearch.com. I would like to end with a quote: "Compassion is the child of righteousness." So in order to be compassionate, we must do the right thing. Thank you.